Hi there. Here we are with our patient Jack, who, if any of you follow me, you've seen him on the website. We did his first surgery when he was 22 years old, so which was about 16 years ago. And he's a fun case to talk about because he was so young. He came in and he really wanted this low hairline. And ultra low. And I was doing my best to say, hey buddy, you're really young. I don't want to do that because I don't want to set you up for multiple surgeries.
Yeah.
So I talked him into a higher hairline. He did it. He was okay with it, but said, I want to lower.
Because I had a 6 head, like a 6 finger forehead, like a massive, like a kind of like a feminine forehead. It was just like, because I feel like a woman can look good with like a high forehead. I don't think men can. So we did like a 6 to a 3 head.
So he wanted to go really low.
Yeah.
So this moral of the story is I tried my best to talk him out of it, and he did his best to talk me into it.
It was a compromise.
And we met in the middle. And I said, I'll be willing to lower your hairline only if I can bring these temples out to balance it. Because what happens is if I put someone's hairline too low, they lose the hair back here. Then as they age, it looks like a shelf sitting off the side of their head and looks ridiculous and has to be corrected. And this is what I do, is I do a lot of corrective surgery, so I know what I'm looking for to not to do for my own patients. Lo and behold, he talked me into it. We did it. It came out awesome. He loved it. He did it. Came back another 2 years after that. So he was here at 22. He was here at 24. Came back at 26 for a third one. Okay. So everything you're seeing here is all transplant. So we restored his entire hairline, brought it down. We reframed him, brought this out to make this look.
Because I was back here.
Yeah. So none of that existed.
Yep.
So we built all that out, and then we did the same thing on the other side. Now, here's what I was trying to explain to Jack. When he was a young man, I said, what happens is this will come back. And lo and behold, this is what I was saying. Yeah. This is all transplants, and this has pushed back. So now, this is what I tell the patients when that goes back. So this is where his hair would currently be, and this hairline would be down here.
Yeah.
So it would look ridiculous. So today, even though I built further into his hair back then, we're going to come back through and we're going to connect that again, make sure that doesn't open up again. He's doing all the treatments as far as preventative treatments to help keep it, but they're not foolproof. You can still lose hair, and I tell the patients this. So one of the things I always want to make sure patients understand is I'm trying my best to get you out of here with the least number of surgeries. The more areas we open up, the more of a chance I might have to come back and fix that later. Jack said, I don't care.
How many surgeries? Yeah. I didn't care if it was 6.
I'll come back as many as I have to. I want this. And henceforth, here we are today.
12 years later, yeah.
So how has this been for you?
So immediate like confidence boost. Like for me, it wasn't just like getting your hair, it was just like getting the confidence back.
Yes.
Like every day I like, wake up and I'm like, please say I still have it here, and I do every morning. And like I don't think I fully need an extra transplant. I'm just kind of doing it because I mean I'm always about like continuous improvement. So I'm like, it's been 12 years. I kind of earned it.
That's awesome.
Yeah, it's just been
awesome. Okay. Well,
I love it.
Anyways, it's a great story. He's been such a great patient. He always follows instructions. He's doing his part as far as the preventive treatments.
Rogaine, Propecia, Minoxidil.
That's awesome.
And then even the Neutrophil.
Okay, man. What I tell the patients, whatever you think's working, stick with it.
Minoxidil, I think, is working really well.
For sure, it does. Minoxidil and Finasteride are my number 1 and number 2 go-tos for sure. Awesome. So it was a great story because I wanted to make sure we got in there about what can happen in the future. And what do you say to the guy who's sitting at home that says, "Oh, these don't work," or "Oh, don't do that. His system's not a good system to do"? What do you say to that guy? Because I get a lot of critique out there.
Well, I think that like the most impressive quality, I think, is someone just like confident. So I think if like you're bald and you just don't give it, you know, concern, don't like, do it if you're not bothered by it. But for me, that wasn't okay. Like I needed to have hair. I didn't look good with like a big high forehead. I just think like if you're gonna have a realistic expectation that you have to have the preventative care, get the hairline to where you want it, and then just maintain it, just like you do at the gym or like at work, whatever it is. So for me, if just, you know, ask the right questions, do your research, and if someone says you're going to get this result in one procedure, you're not. It's like, you know, it takes multiple, and
it's a process.
It's an investment.
It's a process.
It's a return on investment that like I would never have regretted. Yeah.
Well, I watched you turn into a young man into a grown man. It's been such a pleasure, man. Anyways, thanks for doing the video. I'm so happy for you.
Anytime, and they can reach out if they have questions to me too.
Thank you. Appreciate that.